to meet. Let's meet this challenge together. There are some who will say there's no real cause for concern, that we can adjust to this, that there is space in our hospital surge capacity. When did we lose our respect for human life and the economy to the degree that we're saying let's fill our ICU beds and surge capacity before we take any meaningful action? Since when did we decide as a society that instead of saving a life and preventing the spread of the virus, we would treat human lives, the lives of our neighbors, as collateral damage to be dealt with? It was this community, residents of Harris County, that helped neighbors during Harvey. The respect for the lives of others was overwhelming. This pandemic is like an invisible hurricane where all of a sudden your neighborhood is flooding. Your next door neighbor's house is underwater and nobody knows why. Yet courageous, big-hearted people put the lives of others first and braved dangerous floodwaters during Hurricane Harvey to rescue their stranded neighbors. Where are we today? A real expression of freedom is protecting your father, your mother, your child, your neighbor, your friend, coming together as a community and protecting one another's lives, protecting our veterans, the greatest generation that fought in World War II, doing everything possible to get the economy up and running in a smart and sustainable way instead of giving way to slogans and wishful thinking. To me, we have to remember our moral compass. Lives are not collateral damage. We have to remember who we are as a community. We can and must do more. It is for these reasons I'm calling once again on all residents of Harris County and all businesses in Harris County to take immediate action. As such, I've directed that as of noon today, we elevate our public threat level from significant, orange, level 2, to severe, red, level 1. This is the highest possible COVID threat level in Harris County. It means there is severe and uncontrolled level of COVID-19. The outbreaks are worsening, our public health capacity is strained or exceeded, healthcare surge is not only likely, but is already in progress. This is a serious situation, and we cannot let this moment pass without action. Here are the steps every resident needs to take right now to help pull us back from the brink of this crisis. Stay home, except for essential needs like going to the grocery store, food, medicine. Avoid and cancel all gatherings of any size with people you don't share a household with. Essential workers, practice special precautions to prevent spread. All vulnerable individuals, stay home. Avoid non-essential personal travel, non-essential business, public transportation where possible. Cancel visits to nursing homes, long-term care facilities. These are the same steps the community took when we pulled together and flattened the curve a few months ago, when we were an example of how to fight the virus instead of an example of what not to do, as we're turning into now. All along, data and evidence have driven our decision-making when it comes to our work to contain the spread of this virus. And what the data says is indisputable. Our hospitals, the largest medical center in the world, are using 100% of their base operational capacity right now and are beginning to have to rely on surge contingency plans. Since June 13th, we've seen the number of COVID patients in Harris County, ICU and hospital general populations double. Every day since June 13th, our hospital and ICU populations have been higher than our previous highs in April. Whichever angle you look at it from, our situation is far worse today than when we issued the first stay-home order in Harris County and when the state issued their first stay-home order. This is unacceptable. And for those of us entrusted with the work of doing everything possible to protect human life, it begs for aggressive and sustained action. All of this data is what I'm relying on. The curves that show our capacity running out in a matter of days or just a few weeks are conservative estimates. The first time we flattened the curve, it took us weeks. and we may not have weeks. Let me be clear. Plenty of people are trying to grasp at straws, to point out a hospital bed here or there, or say that we should simply close a few things. Nobody who opposes bold steps is providing me with an alternative interpretation of this data. Nobody that opposes these steps is providing me with any evidence that something short of a full stay-home order will work to avert the crisis right now. Wishful thinking is neither good public health policy nor a good economic sustainability policy. We know what works and what doesn't. What works are sustained social distancing practices over time. What works is a stay-home requirement. What does not work is the status quo, and that should be obvious to anyone. It's time to look at the truth straight in the face and be real. Anything in between, staying home, or what's currently happening, is a gamble and an experiment on our own people. And not only is that wrong, we do not have the time for that. I desperately want our economy to reopen and to recover as quickly as possible. I have always fought for people's ability to support their families, but that cannot happen when our economy is held hostage by this virus. This is not a binary choice between health and the economy. Simply setting it up the way some folks are attempting to do is a false dichotomy and is misleading. They're going to take us back to the very same place where the very same businesses and people are threatened to where we have to shut down again. If we really want to get to the other side of this, and we can, and we will if we work together, we need to buckle down now, bring down the curve, and then be smarter about how we reopen. The only way to reopen more successfully is to bring those levels way down. Looking at other communities, not only did they flatten it, but they brought the curve way down before they started reopening. We can learn from the communities that have been reopening successfully. We can be responsible and for our community, not just for our economy, but for our health. It will not be easy, but I can tell you this. The more united we are in this effort, the faster we will get through this. We must bring that curve to the other side, get a fresh start, draw lessons from other communities, and reopen sustainably. Be responsible. Be the smart, tough, compassionate community we know we are here in Harris County. We need to be especially united because we're doing this with one hand tied behind our back. We don't have authority that we had in Harris County early on. No longer can I issue an enforceable stay-home, work-safe order. And this time, we actually have to be even more successful than that time. We're well past that point. So we're going to have to work together, Harris County, to do this ourselves. I am issuing something very similar to the initial order. It will be an advisory, but it will mirror the initial order almost exactly. It will change the language to advisory. I urge everybody to do this. Last week, the governor allowed us to reinstate a face covering order as long as businesses were the ones enforcing it. 2 days later, we had one up. Just a couple of days ago, he said we can regulate events of under 100 people, and today we were given new authority in that area. So as of right now, outdoor gatherings over 100 people are prohibited in unincorporated areas of Harris County, and I urge all cities within Harris County to do the same. This authority from the governor does not allow me to cover the entire county. With July 4th coming up, we'll allow shows where people will be in their cars. We will not be allowing any gathering, outdoor gathering over 100 people where folks are congregating. As the governor makes more tools available, you better believe we will take advantage of every single one of them. But at this point, I'm asking the community to go well beyond that, because the evidence all shows that nothing less than that will do. And we must step up, especially when it comes time to make tough decisions. I'm doing this because anything short of staying home is setting us up for failure. I'm here to help us succeed in our urgent effort to save the lives and health of our people, of our loved ones, our neighbors, our friends, our coworkers, and to get the economy back on track. And I will do everything in my power to get us there. But we need to work together, all of us. For those of you across the nation who are watching what is happening here, let me say this. Consider us the canary in the coal mine. You can look at what is happening here and know that there are no shortcuts to getting around the COVID crisis. It takes hard, bold decisions. It takes entire communities working together for a sustainable, continual period of time and a willingness to work together in the interest of all of us. Harris County is a special place. We've been through hurricanes, we've been through chemical fires, other disasters. Each time we pull through because of the grit and determination of this community, and we can do it again. In the meantime, if anyone is able and willing, we encourage donations to the Greater Houston COVID-19 Relief Fund. The information is at readyharris.org. It will help our community, and as we have additional needs, we will make them clear to the nation. Look, we flattened the curve before. Until we stop the bleeding, we will not be in a position to sustainably open. We will not be in a position to move beyond that, and we're smarter than that. We know success will not happen overnight. I am not going to pretend I am not going to tell you that. It will take time. It will take hard work. It will probably take longer than initially if we actually want that curve to come down and we want to get smarter about this. We can do this, Harris County. Let's hold our heads high. Let's be smart. Let's buckle down. Let's be tough, because that's who we are, and let's go forward. Thank you so much. We will hear now from Dr. Umair Shah, who's the director of our Public Health Department. Then I'll repeat my remarks in Spanish, and we'll take questions. Dr. Shah.
Thank you, Judge, for your comments just now, and again, for your leadership and your support. Really want to thank you for that. My name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health and the local health authority for Harris County. I want to underscore what the judge just said. Let's make it very simple. Enough is enough. We have a real issue in our community right now, and all of us have a part to play in solving this issue. While we recognize that the governor today, the state today, even the judge just now, as she underscored the raising of the alert level to red, that at the end of the day, we recognize that we are really at that point where we have to all work together to fight this pandemic. We know that we are one of the leading communities in the nation, in fact, one of the leading communities in the world. And we usually lead in a way that means that we all come together. We have done this through a number of emergencies. Well, prior to all of us, we've had emergencies in this community, and certainly we are in the midst of one of the worst emergencies that we have ever seen on this planet, and certainly it's impacting us here in Harris County. I cannot stress enough the severity of this situation. If I said to you that we have been up here, and from a public health standpoint and a true health and medical standpoint, we have been saying week after week, wear your masks, wear your cloth face coverings, wash your hands, physically distance, stay away from large gatherings. Do not go out unless you have to. Limit your interactions with others. Do everything you can to monitor your symptoms. Do everything you can to get all of that information that you're hearing all over the news from all sorts of sources to one singular point, which is this pandemic is far from over. This pandemic continues, and we have to fight this together. If we do not fight this together, unfortunately, all the things the judge talked about is what is going to be the history, but the future of where we are going. And we want to make sure we do all of that. Now, there is hope here, and that hope is that we have done this. As the judge mentioned, we have fought successfully this pandemic. Thus far, during the early stages and during the stay home, work safe orders, the case rates, the death rates, they have shown that we have been successful. We did that not just because of us, but because of all of us. We have fought this pandemic successfully. But we are now at a different phase. And people believe that because we have reopened, that it means that you can go out and do whatever you want to do because life is back to normal. I'm telling you, from a health standpoint, life is far from normal. And we are really needing all of you to do all of the things to help us fight this pandemic. I also want to underscore that just this week, the CDC said that pregnant women who contract the virus are at greater risk to be hospitalized. They also may need, more likely to need intensive care level of care, an ICU bed, and they may even need to be put on a ventilator. It is a measure of society, not just how we all protect ourselves, but we protect those who are more vulnerable in our communities. And whether that's an elderly person in our community, whether it's one of our family members who might have a serious health condition, whether it's a child in our community, whether it's a neighbor who has some existing condition, whether it is a pregnant woman. It is up to all of us not just to protect ourselves, it is also up to us to protect our community. And I want to say that we are one of the most generous and caring communities out there. Our previous responses to hurricanes and even fires and all sorts of activities over the last few years shows that we always step up as a community. But we cannot step up as a community if we do not remember that we are still in the midst of this pandemic. This economy doesn't work if people are afraid to go out, to shop. But what we also have to recognize is that there is a balance. We need to be smart. And the judge is absolutely right. If you do not need to go out, do not go out. Stay home. Be vigilant. Don't do all the things that might get you at a point where you are spreading this virus and making it worse. We also want to say, at the end of the day, that wearing your mask, washing your hands, social distancing, avoiding gatherings, limit your ability to be out if you don't have to. In other words, stay home if you can. If you're sick, avoid others. Get tested. Don't guess, take the test. And we also, from a public health standpoint, are doing everything we can because ultimately we're in the prevention business. We are not wanting to see an overrun in our hospitals or our healthcare system. What we want to see is strong support from our community to do all those things to help us fight this pandemic. We continue to work together. It is up to all of us how these chapters will be written in our community, whether the chapters are going to be written that we were successful or the chapters are written, as the judge said, that we're going to look back and say we had an opportunity, a strategic opportunity to fight this pandemic, and we simply let it go. So let me just close by saying that it is up to all of us. All of us are in this together. We cannot fight this pandemic alone, but you have to keep in mind health and safety in every single thing you do, and you have to be meticulous, and we have to do it continuous to help drive this pandemic away from our community and fight it as best we can so we do not see worse outcomes. Thank you very much for everything you're doing. You have worked with us, but we still need you to work with us yet again. Judge, I'll turn it back to you.
Thank you so much, Dr. Shah. Let me repeat the remarks in Spanish. Empezando por clarificar que pase lo que pase, vamos a seguir trabajando por luchar y vencer este virus. Pero la realidad es que hoy nos encontramos yendo a toda velocidad hacia una situación catastrófica y no sostenible. La tasa de hospitalizaciones está ya en camino para sobrepasar la capacidad de los hospitales en el futuro muy cercano, entre días y pocas semanas. De todos los países alrededor del mundo, los Estados Unidos es uno de los peores en cuanto a los indicadores de este virus. Y dentro de los Estados Unidos, ahora ya nos hemos vuelto una zona de máxima transmisión. Eso significa que a nivel global somos una de las comunidades más afectadas. Nos están observando no solamente las personas alrededor de este país, sino también alrededor del mundo. Y la historia recordará si tomamos acción o no. Este es el momento de ponernos serios y trabajar juntos. Si reconocemos que nuestras acciones individuales van a salvar las vidas de muchas personas en esta comunidad, vamos a lograr vencer este reto. Hemos sobrepasado retos antes. Esto es posible. Hagámoslo juntos. Hay personas que me van a decir, o que están diciendo ya, que no hay necesidad de estar preocupados, que nos podemos ajustar, que hay suficiente espacio en los hospitales. ¿Cuándo perdimos el respeto a la vida humana a tal nivel que ahora estamos diciendo llenemos nuestras unidades de cuidados intensivos y en lugar de salvar vidas y prevenir muertes, simplemente esperemos a que se llenen estas camas de hospital? Tratemos las vidas humanas como daños colaterales. Fue esta comunidad, los residentes de este condado, que ayudaron a sus vecinos durante el huracán Harvey. El respeto por la vida humana fue increíble. Esta pandemia es como un huracán invisible que ha inundado el hogar de su vecino. Siempre estamos listos para rescatar, para ayudarnos los unos a los otros. Este es el momento de sacar ese espíritu de compasión y de trabajo en equipo, en comunidad. El proteger la libertad de todos es proteger su padre, su madre, sus hijos, sus vecinos. Unirnos como comunidad y proteger, respetar las vidas de todos. Hacer todo lo posible porque la economía funcione de una manera sostenible e inteligente. Para mí, las vidas no son daño colateral y tenemos que recordar nuestra brújula moral, nuestra ética, quiénes somos como comunidad. Debemos hacer más. Es por esa razón que estoy pidiendo que todos los residentes tomen acción inmediata. He dirigido que empezando hoy al mediodía elevemos el nivel de amenaza de sustancial, naranja, nivel 2, a severo, rojo, nivel 1. Ese es el nivel más alto de amenaza del coronavirus en el condado Harris. Significa que hay un nivel del virus que es severo y no controlado, que se está empeorando la situación, que la capacidad de salud pública se ve estresada y que el espacio adicional en los hospitales no es suficiente y ya se está llenando. Esta es una situación muy seria y tenemos que tomar acción. Lo que debemos hacer, quedarnos en casa, excepto por las necesidades más importantes, como ir al supermercado o recoger medicina en la farmacia. Cancelar todas reuniones de cualquier tamaño, a menos de que sean con familia, con quien usted vive, con personas con quien usted vive. Los trabajadores esenciales, tengan cuidado, tomen precauciones y también los empleadores esenciales. Todos individuos vulnerables, quédese en casa. Evite viajes, transporte público. Son básicamente los mismos pasos que tomó la comunidad la primera vez que hicimos esto hace unos meses, cuando fuimos un ejemplo de qué se debe hacer y no un ejemplo de cómo fallar, como lo estamos siendo ahora. Desde siempre hemos sido guiados por la data, evidencia, números. Y lo que dice la información, lo que dicen esos números es muy claro. Los hospitales, en el centro médico más grande del mundo que existe aquí en el condado Harris, están ya utilizando 100% de su capacidad base y están empezando a tener que trabajar con su capacidad adicional. Desde el 13 de junio hemos visto el número de pacientes de coronavirus en el condado Harris, en la unidad de cuidados intensivos y también en la población general, que ya se ha duplicado. Cada día, desde el 13 de junio, nuestra población, tanto en el hospital, la población general y en las unidades de cuidados intensivos, han excedido los números más altos que vimos en el mes de abril. Desde cualquier ángulo que mire, cualquier perspectiva, la situación hoy día es mucho peor de la que había cuando primero instituimos la orden de permanecer en casa y cuando el Estado instituyó su primera orden de permanecer en casa. Tenemos que trabajar urgentemente. Las curvas muestran que nuestra capacidad se va a terminar en unos cuantos días o semanas. Y esos son estimaciones conservadoras. La última vez que aplanamos la curva nos tomó 44 días. Puede que no tengamos muchas semanas. Para ser claros, hay muchas personas que están intentando crear excusas, que están intentando decir que hay una cama de hospital aquí o allí, que debamos solo cerrar unas cuantas cosas. No hay una sola persona que oponga las medidas que estamos tomando hoy, que me haya podido mostrar una interpretación alternativa de los números que estamos viendo. Nadie me puede demostrar que con tomar acción menor a una orden de quedarse en casa podemos aplanar esta curva y bajar la curva. La esperanza no es una estrategia. Los sueños, lo que nos gustaría que sucediera no es buena política pública, no es buena política para reabrir la economía. Sabemos que funciona, sabemos que no funciona. Lo que funciona es el distanciamiento social consistente, el quedarse en casa. Lo que no funciona es el status quo, la situación presente, y eso debe ser obvio para todos. Cualquier cosa entre lo que está sucediendo hoy y el quedarse en casa es simplemente un experimento hecho sobre nuestra propia gente. Y no es simplemente eso problemático, no tenemos tiempo para experimentos. Quiero que la economía reabra, que se recupere lo más rápidamente. Siempre he luchado por la habilidad de las familias a sostener a sus hijos, a todas las familias. Pero eso es simplemente imposible cuando nos vemos rehenes de este virus. No es una decisión entre la salud y la economía. El ponerlo así es simplemente una decisión falsa. Las personas que nos están diciendo que tenemos que decidir entre la economía y la salud simplemente nos van a llevar a la situación en la cual tengamos que volver a cerrar, volver a lastimar a estas personas que están intentando apoyar a sus familias. Si queremos realmente pasar esta crisis, tenemos que trabajar juntos ya y ser más inteligentes luego acerca de cómo reabrir. No va a ser fácil, pero entre más trabajemos juntos, más rápidamente vamos a poder sobrepasar esto. Tenemos no solamente que aplanar la curva, pero bajar esa curva para vernos como otras comunidades, las que sí han sido exitosas, trabajaron por muchas semanas, reabrieron después, pero cuando reabrieron lo hicieron de una manera inteligente, paulatina, y de esa manera no han vuelto a ver una nueva crisis, van a poder seguir reabriendo. Tenemos que ser responsables, tenemos que ser inteligentes. Tenemos ahora una segunda oportunidad, va a doler mucho, pero hay que trabajar juntos y ser realistas. Hay que trabajar juntos mucho más que antes porque estamos haciendo esto con una mano atrás de la espalda. No tenemos autoridad en este momento en el condado Harris de efectuar una orden de quedarse en casa como lo hicimos la primera vez. En este momento tenemos que ser aún más exitosos que la primera vez, pero tenemos que hacerlo solamente con recomendaciones, porque no tengo esa autoridad del Estado. La semana pasada, el gobernador nos permitió reinstituir la orden de los tapabocas, de las mascarillas, siempre y cuando los negocios eran los que iban a implementar eso. 2 días después teníamos la orden. Hace 2 días el gobernador dijo que podemos cancelar todas las reuniones por fuera, al aire libre, de más de 100 personas. Hoy ha dado autoridad adicional para cancelar esas reuniones. Estoy lista en este momento, desde ya mismo todas las reuniones exteriores de más de 100 personas están prohibidas en las áreas del condado Harris fuera de alguna ciudad. Ahora, el gobernador no me ha dado la autoridad de hacer esto en todas las ciudades del condado, entonces le pido a todos los alcaldes que pongan de su parte y hagan lo mismo. Que viene el 4 de julio, vamos a permitir simplemente shows donde puedan las personas disfrutar de eso desde el auto, no van a haber reuniones de más de 100 personas. A medida que el gobernador haga más herramientas disponibles, estén seguros que vamos a utilizarlas. Pero en este momento tenemos que hacer muchísimo más de lo que él ha hecho disponible. ¿Por qué? Porque la evidencia nos muestra que eso no va a ser suficiente. Nada salvo el quedarnos en casa va a ser suficiente. Tengo que hacer esto porque tengo que poner a la comunidad en una posición para poder ser exitosa. Estoy aquí para ayudarnos a llegar a ese éxito, proteger las vidas de la comunidad y también proteger la economía. Y haré todo lo posible porque logremos pasar esto juntos, pero tenemos que trabajar juntos todos nosotros. Aquellas personas que están viendo de otras partes del país, véanos a nosotros como el experimento. Están viendo lo que está sucediendo aquí y se dan cuenta que no hay atajos. No es posible acelerar la cosa, la reapertura y esperar que el virus se va a desaparecer. Toca trabajo fuerte, sacrificios, trabajo largo, muchas semanas. Estas comunidades han tenido órdenes algunas 80 días, pero ahora se ven los frutos de su sacrificio. Este condado es muy especial. Juntos hemos pasado muchas inundaciones, incendios en el último año, ahora esto. Siempre logramos sobrepasar esos retos porque trabajamos juntos. Lo hemos hecho antes, lo seguiremos haciendo juntos. Y aquellas personas viendo otras comunidades, los invito a donar a nuestro fondo de recuperación para la comunidad que pueden visitar en readyharris.org. Miren, hemos aplanado la curva antes, lo podemos hacer nuevamente, pero lo tenemos que trabajar muy fuertemente. Sabemos que la solución no va a llegar de noche a la mañana, ni un par de días, ni un par de semanas. No voy a pintar una imagen que es falsa. Vamos a tener que trabajar mucho. Hagan su parte. Lo hemos hecho antes, lo podemos hacer nuevamente. Ahora es a levantar la cabeza, ser orgullosos de esta comunidad, adelante y a trabajar juntos. Muchas gracias. Thank you so much. We will now take any questions.
Judge, we've got a lot of questions here, as you can imagine. First of all, it's the first time that the color wheel will be on red. So what should that impart to people, and how do you anticipate that some lives and routines might change?
What we're saying today is we are at the highest level of activation. If we do not act now, we will be at the point of no return. And we need folks to do what they did 2 months ago when we issued a stay-home order. We will put online the advisory that will have the same parameters. So what you did then is what you need to do now. It's time to work together. We can do this. But at best, we have to do what we did before. Remember, that took a while, and we buckled down. We never brought the curve all the way down. We only flattened it. We can't flatten it now because it's right at surge capacity. This time, we actually have to bring it down so that we can reopen sustainably, so we can be smart and move past this. And so today, right now, I am asking the community to stay home, to remember that we are crossing 100% operational capacity. These charts right here are all our Harris County hospitals, and that is where they are. So it's time for action. I know this is exhausting. I know we all want to move on with their lives. It's summer. People have the children at home. They need to work. Folks are out of jobs. It's only going to get harder. But folks, let's be real. We will not get through this if we don't look at the reality of the situation. We have plenty of evidence from around the country. The states, the places that are being able to reopen sustainably are the ones that buckled down all the way through to bringing the curve down, and then were responsible and paused in opening up. That's what we have to do. Otherwise, we're going to be right back where we were. And if we don't act now, we will be in a crisis. We have to stay home now, or we will be forced to stay home when we have images of hospital beds in hallways and we're having to activate our medical shelter. Let's not get there. Let's respect human life in this county.
And yet there are still some businesses open, and I assume that you are also asking people, do not go out unless absolutely necessary, to go to the doctor, to go to get groceries or pharmacies.
That's right. The ask is for folks just as it was before. Stay home unless you need to go get to the grocery store, medicine, visit somebody that you're taking care of, go out for a run, walk the dog, or if you are an essential worker, and it'll be the same definitions as before. And we are asking all of our business community to stand up and work with us. Right now, there is not confidence in our economy, and there will not be until we move past this. And businesses are, people are confident enough to where enough folks are going out that they're getting one another sick. But they're not confident enough to actually make the economy sustainable, to make these businesses sustainable. So let's get this right, let's try it again, and let's move forward.
What is your response to the governor scaling back?
Great. I'm so grateful he's taking those steps today. They are important. They're necessary. I've been urging him to let us make an enforceable stay-home order or order it himself. Obviously, that's not where we are. I'm here taking this step because I've been firm that that is what we need, and I'm not seeing any evidence that anything short of that will do the trick. It took us more time back then with a stay-home order to flatten the curve than we have now that we're in a more dire situation. So obviously, something less restrictive is not going to do it. And as I said, wishful thinking, hope is not a strategy. We all wish we didn't have to do this. I don't want to do this. But it's the only option. It's the only evidence. So I'm going to keep pushing for that enforceability. Obviously, as always, the priority would be education, as it's always been. I think the first time around we didn't have to issue a single enforcement, but having that enforceability clause makes a difference. I'm under no illusion that it's going to be easier this time. We saw what happened with face coverings. The minute it became unenforceable, folks weren't doing it anymore because it sends a signal that it's important, not because we're going to be out there policing it. And that's why I'm asking the community to work together. Look, we don't have that tool, so let's buckle down even more. Let's do it. There's no other option.
And has there been any enforcement action or citations written up until this point for overcrowding?
So far, obviously, we have to check with all of the individual cities. I will say I've always been very, very proud of the community for working together when we have those clear regulations. When we had the initial bars and restaurant order, the initial stay-home order, they were very effective in terms of us sending, law enforcement going and educated. As far as I am aware, they did not have to issue citations, but the mere fact that enforcement provision was there was what helped with compliance, because they were able to go and say, look, please do this. This is what you should be doing, or else. That's what's important, but it's not about being a police state and proactively seeing how many fines we can collect. We have continued to do that right now, but frankly, as of before, the governor's new restrictions, pretty much everything was open, right? The Rockets could have had a basketball game, they just didn't want to. So we're just now scaling back, and we're scaling back to a degree that I don't believe is enough, but I will make use of every single tool we have available. I am very grateful for the governor making those tools available, and we'll continue to follow through, continue working with him, because this situation demands that the state and county work together.
But how would you curtail it then? What do you think are possibilities?
Say that
if
again,
there is
quickly.
overcrowding, if there is a violation of the order, how would you curtail it now?
Right now, it's the same as always. Law enforcement will be out educating. If there's a situation, they will use their discretion where they need to issue a citation, they will, but that will be a last resort. We, as of today, our face covering order is also enforceable, so the fine will be enforceable for each day of a violation. Law enforcement knows that, and they know that the priority is education. But remember, we've done this before. We have evidence that what works is having an enforceability provision and focusing on education. So I don't want anybody saying, well, because you haven't enforced it doesn't mean it's not working. We made a stay-home order work, prioritizing education, but we need that enforceability clause. Now, we're splitting hairs again. People should not be out. We should not be at a point where we're talking about capacity. That is not enough. We are in a worse situation now than we were back then. And the only thing that worked back then was that flattening that curve by staying home. We don't have time to do an experiment on our own people right now. By the time we realize that 50% capacity doesn't work, it'll be too late. And that's why I'm asking folks to stay home, and I'm asking businesses to stay home. Order takeout. Support your local restaurant. Support, order online. Go outside, go for a run, go for a walk to keep yourself healthy. It's hard, I know. But we brought ourselves into a situation because we opened too quickly. We have to do better, we have another chance, and we have to work together.
And in terms of testing, what is the status of the tests that are available, the wait times? I know that there seems to be increased interest in people getting tested.
We've been working so hard at Harris County Public Health to make all tools available. So testing, tracing, making sure that there's space for first responders who have the virus to quarantine away from their families so they don't get them sick. visiting nursing homes and other areas where folks are in close contact. We'll continue to throw everything we have at this virus. Of course, we need the community. In terms of testing, we've got 2 fixed sites. We've got 6 mobile sites that have visited, I think, upwards of 30 locations at this point. Great success in the community. Our wait times are 30, 45 minutes, and we try and keep them faster than that, and we're going to keep striving for that. We need people to get tested. Folks can register at readyharris.org. It's free. We're not asking for insurance, and it'll help. But as always, if you're sick, stay home. Assume you have the virus, and regardless, we need people to stay home right now if we want to see a change in these trends. However you look at it, this is a 14-day trend, a 7-day trend, are both at the 95% confidence level, and all we're doing is stretching them out linearly. These trends actually are growing quadratically. They're not growing linearly, so we're being conservative. We're making a line out of them. And it shows that we have between a week, less than a week, and 3 weeks remaining before we run out of all capacity. I hope we're wrong. Let's make that be wrong. Let's work together and flatten this curve. We have got to buckle down.
And Judge, with the medical center, oh, I'm sorry.
I'm sorry, just wanted to add to what the judge said. So the 2 FEMA-supported sites at the county, they have a capability of testing at 750 tests a day, times 2, so 1,500 tests a day. We are exceeding that capacity. In fact, until the weather played havoc, we've had a lot of rain, as you know, some even flooding. That's really changed and challenged some of those test sites. We've had really increased demand in our call center, as well as online, as well as into the actual testing sites. Our test sites have actually started to see some of the wait times grow a bit. More Judge is right, it's usually about 30 minutes. Sometimes it's actually been 20, 30 minutes. And under that 15, 20 minutes, we've actually grown to about an hour now because of the weather and the other challenges that we've had this week and the last several days. So I just wanted to make sure to underscore that point.
So it's available, but I guess the demand will only increase.
That's right. The demand is only going to increase, and the way to prevent all of this is minimizing contacts. We know this virus spreads from person to person, and that's why it's logical that we are where we are, and we know what the solution needs to be.
And so with the medical... Well, I've got some of the pool questions here. Okay. And with the medical center at 100% capacity, what are the plans for opening NRG?
We have had NRG medical shelter available as a shelter of last resort, and it is on standby, ready to activate within 48, 72 hours. Now, what that shelter needs to be is, as I said, last resort. So once the hospitals are at a point where they're having to convert their beds to ICU beds, where they're close to running out of their own surge beds, then we will activate it, because we don't want to create an incentive for folks to just use this as a replacement for the capacity they could have created. I don't want folks to see this as additional capacity that we have. NRG Medical Shelter is temporary. It is not long-term. And again, human lives are not collateral. The point is not to figure out how can we fill every single bed in this county and somehow still hope to be reopened. That is not a logical plan. But we're ready to activate when needed.
What's your sense that it will be needed?
I can't say that at this time. I hope it won't be. It really depends on what the community will do. And that's why we're here today, to say we can do this, we can work together, we need to stay home, we need to buckle down. Let's avoid a situation in which our healthcare system is in such dire straits that we're having to send folks to a temporary medical shelter that is only for a worst-case scenario.
And there are also concerns about adequate medical personnel availability. There is one doctor in particular who says you can add beds, but without the personnel, the nurses, it's not going to work. His question has been, why cannot the state loosen the standards under emergency orders and bring personnel licensed in other states into Texas?
I'm sure we will. If we cross that line, everybody will take the steps necessary to make sure that we maximize our personnel. But again, let's take a step back. When did the calculus become how much can we work these nurses and doctors, how many beds can we stick into a hallway or an auditorium and then take action? That is not how we should be thinking about this. We have to avoid that. When you see that kind of situation, that's the story of New York. That's the story of Italy. We can do better than that, Harris County. And that's what we need to avoid. It's not a matter of figuring out how we get there exactly. And remember, we get there and then what? Then we're going to reopen? We can't do that. We have to bring this curve down. It's not going to come down on its own. So we need to all be respectful not only of one another, but these healthcare workers. They're humans. They're people. They have families too. They're exhausted. They've been working this whole time. And yes, we have a reserve corps, and we'll be working and pleading with the country if we need more people, and I will be the #1 person advocating for whatever standards need to be changed to be changed. But what I'm asking the community today is to not let us get there, to not forget our moral compass, our humanity as a community. That is not what we're going for here. And I don't know what happened between Harvey and now, but we have to remember who we are as a community.
A question from KHOU. What changes will there be on church services in the county following the Code Red activation?
The recommendation is, as it has always been, unfortunately, the virus will not leave just because you are in church. We know of many examples, whether it is the choir, whether it's the churchgoers, and so I urge faith leaders also to help us with this. Faith leaders have been a rock throughout all of this, not only leading folks in their faith, but supporting them through these challenging times. And they have been incredible in fighting to make sure that the congregation is safe as well. So we're calling on you all again to help us with this. Of course, the requirements are clear that it can happen, but just because it can doesn't mean it needs to, nor that it should, because we have got to flatten this curve. And there are no shortcuts.
And for Dr. Shaw, how long do you think it will take to flatten the curve again? And do you think it will be a problem throughout the summer?
And let me just, before Dr. Shaw comes on, I'll tell you, we have looked at states all over the country. And so when you look at it, and I have these tables here, is the states that have brought their curves down, all the way down, is consistently that they kept their stay home for longer. And so, you know, days between the peak and it coming down, some states around 80 days, some states around 90 days. I'm not pretending that this is quick. And that's the thing, folks, is wishful thinking got us here. So we need to be real. If we want to do this right, we have now examples of what works and doesn't work. And our suspicions were correct. We try and take shortcuts. We try and pretend that this virus has gone away. We're going to be right back where we started. And that's worse for the economy. It's worse for all of us. It doesn't make sense. So if we want the curve to actually come back down to a point where we would reopen sustainably and move beyond this, the more we buckle down, obviously the faster it'll be. And that's where obviously having this be enforceable is much more effective. But short of that, I'm putting us a red alert and I'm asking the community to do their part. All of our leaders, faith leaders, business leaders, families, we all have to do our part in this. Do you have anything to add, Dr. Shaw?
Thank you, Judge. Judge is correct. What I would just add to it is that we've been calling this the layering effect, that as reopening has happened, and on top of that you've had holidays or milestone events or activities, that generally you see a few weeks after any one activity for you to start to see an increase in transmission and or you start to see increased cases or what's happening in the hospital system. The reverse is also true, right? So as you dial back, it generally takes a few weeks for you to start to see the impact of that decision. So what we're seeing in the healthcare system or what we're seeing in our testing numbers, et cetera, that you're seeing today doesn't reflect today's activity. It actually reflects the last few weeks, the summation, if you will, of all those activities. And then that also gets to that second part of the question, is that unfortunately, Judge is right, this is up to us in terms of how far this goes in the summer into the fall. As you know, there is a lot of concern across the country that we're going to continue to be doing this for a few months back and forth, and then we're back into the fall with flu season, and we have no vaccine still. There is no magic bullet for COVID-19. It's tried and true prevention, and now we're back into a worsened situation. That's why we have to do everything we can to suppress this virus now, and certainly to fight the pandemic as a community.
And then there are some questions from Telemundo and Univision, if you could answer these in Spanish. How quickly can NRG be activated to receive patients?
En cuanto al refugio médico en NRG, ese refugio se puede activar entre 48 y 72 horas. Está listo para ser activado. Pero realmente eso es el último recurso. Cuando ya se estén viendo los hospitales utilizando sus camas de última opción, es ahí que estaremos activando el refugio médico. Y quiero recordarle a la comunidad, la idea no es llenar todas esas camas y ver a ver qué pasa. ¿Qué vamos a hacer después? ¿Reabrir cuando estén todas las camas llenas? No, tenemos que ser realistas, trabajar juntos, bajar esa curva, va a tomar tiempo, pero esperemos que no vamos a necesitar ese refugio médico.
And in a level 1 situation, how can the county enforce stay-at-home recommendations?
En este momento estamos ofreciendo recomendaciones de quedarse en casa. He estado trabajando, abogando por nuestro condado con el gobernador, con el estado, pidiéndole que nos permita poder implementar una orden. No me ha dado esa autoridad. Obviamente sí nos ha dado la autoridad de cancelar reuniones de más de 100 personas, solamente en áreas fuera de las ciudades, también la autoridad de las mascarillas dentro de establecimientos, pero es claro que eso no es suficiente. Lo único que sabemos va a funcionar es quedarse en casa. No puedo yo esperar hasta que él dé esa autoridad. Tengo que decirle a la comunidad que eso es lo que hay que hacer. Es más difícil sin tener esa autoridad. Es más difícil explicar a todos lo importante que va a ser esto. Entonces necesito su ayuda. Los líderes religiosos, los líderes de familia, líderes en la comunidad, ayúdenos, de negocios, trabajemos juntos. El hecho de haber abierto muy rápidamente es lo que está llevando a esta segunda curva, a este segundo cierre. Si lo hubiéramos hecho bien desde el principio, estaríamos reabriendo de una manera sostenible como lo han hecho tantos estados. Entonces, no podemos hacer lo mismo nuevamente. Hay que trabajar juntos y va a ser un poco largo tiempo, pero es lo único que podemos hacer para evitar una situación todavía peor, no solo para la salud, sino también para la economía.
And the one question here from us, have you seen any recent events as common threads for the spike through contact tracers? In other words, the protest, the clubs, Memorial Day.
Yeah, there's a couple of things on that. All these events, every event that has close contact with people, of course, it is likely to increase the transmission, to lead to these increases we're seeing. As Dr. Shaw has explained many times, it's layering all these events on top of each other. And so I would venture to say that Memorial Day, that protests had an impact, and so have all folks going to restaurants and bars and clubs and getting together as if nothing was going on. As we study all of these states, and we've looked at Massachusetts, Oklahoma, Washington, Arizona, we're looking at us, we're looking all throughout the country and world. The one thing these states have in common is the ones that reopened more slowly, that didn't reopen as many things at once. The ones that reopened later, they waited until the curve came back down. Those are the ones that are being successful. They also had protests there. They also had Memorial Day there. And yet, look at where we are. And so what is clear is we have to stay home. That's the thing that works. And once we get on the other side of this, and that does not mean flattening it, because if we open there, we will be in trouble. That means working until that curve comes down on the other side. Then we need to be very smart, and we can cheat a little bit, because now we can see what these other states have done and learn from them. And we can see, okay, that one's not working, don't do that. That one worked, let's do this. And what they have in common is they worked for longer, but they're not having to issue a second shutdown. Now we're going to have two stay home, of course, one order. This I'm asking the community, urging them to work with us and add it together. it's going to be so much harder, but we have no other option unless we want to even add more to that length of time.
Okay, gotta wrap it up.
Sure.
Thank you.
Judge, could you answer one more, though, for Univision?
Can I take
It's a majority of the coronavirus cases in the county are Hispanics and African Americans. What measures does the county plan to take regarding that?
Sí, sabemos que la mayoría de las personas afectadas por este virus han sido latinos, minorías. Es increíblemente difícil. Parte es el paso que estamos tomando el día de hoy, esta orden de quedarse en casa. Obviamente la incidencia de personas afectadas fue muchísimo más baja cuando estábamos bajo orden. Entonces, no orden, sino recomendación, el pedirle a la comunidad que por favor se queden en casa nuevamente. Háganlo no solo por toda la comunidad, sino nuestra propia comunidad latina. Miren cómo se ve de afectada. Entonces, trabajar juntos en eso. Estamos estudiando también los impactos distintos que está teniendo este virus en varias comunidades. Los fondos que se han hecho disponibles son específicamente para personas de bajos recursos, entonces las personas más impactadas podrán accederlos. Y miren, mucho de esto es estructural, institucional, la falta de acceso a la salud en nuestras comunidades. Y esos son proyectos de más largo plazo que estamos tomando en cuenta aquí en el condado. Pero por hoy, adelante a trabajar juntos todos. Thank you so much.
Harris County Judge Lina Hidalgo there. We're going to take you now to the White House, where for the first time in several weeks, an update from the coronavirus task force. Here is the Vice President, Mike Pence.
Because we're all in this together. And the progress that we made, that you saw illustrated in those charts in places like New York and New Jersey, Connecticut and New Orleans, was a result of the American people stepping forward, heeding the guidance of federal, state, and local authorities. And we encourage you to continue to do just that. But for those in the areas most affected, we just want to encourage you to listen to and respect the guidance of your state and local authorities. Recognize that this is different than 2 months ago, both in our ability to respond and in the nature of those that are being infected, and that younger Americans have a particular responsibility to make sure that they're not carrying the coronavirus into settings where they would expose the most vulnerable. And lastly, as I prepare to bring Dr. Birx to the podium, I just encourage every American to continue to pray. Pray for all the families that have lost loved ones. Pray for our healthcare workers on the front lines. And just continue to pray that by God's grace, every single day, will each of us do our part to heal our land. With that, I'll introduce the coordinator of the White House effort on the coronavirus, Dr. Deborah Birx.
Thank you, Mr. Vice President. Thank you for that great introduction. Just to remind everybody where we have come from in the last 4 months, we have a great deal of understanding now about the differential disease. Differential infections, no. We believe everybody is susceptible to infection. But we know infection leads to a spectrum of disease, and we have much better details about who is vulnerable and why they are vulnerable. And as the Vice President said, at one time, we were diagnosing people in the ICU after they came into the emergency room.
Yes, I got
and
you.
thanks to the millennials who have been heeding our guidance, they have been coming forward and getting testing. And so whereas before we told them to stay home, now we are telling them to be tested. And this is a great change for us because it allows us now to find the asymptomatic and the mild diseases that we couldn't find before. As Dr. Redfield talked about yesterday, from the serology test, we have a great understanding of what was happening in March and the number of asymptomatic and mild conditions that led to individuals to have antibody but never come forward with significant disease. We now know who's at risk for significant disease, And we now know it's particularly the elderly, individuals over 80, and individuals with comorbidities. And remember, those comorbidities span the entire age group. We do know that we have people in the younger age groups with significant type 1 diabetes, and may also have individuals with significant obesity. We know that those are risk factors, and so risk factors go with your comorbidity, not necessarily with your age. And so as we call on individuals to protect one another, by passing someone on the street, you don't know what comorbidities they have. And this is why we've been focused on trying to protect one another. We also know who's at risk for the highest mortality, and because of that, we've been able to, the clinical care has dramatically improved. And I want to thank NIH, who has been working constantly to update the clinical guidelines. So physicians around the United States and frankly around the world who are using those have the most updated information about how to actually improve disease courses of those that are in the hospital. We, of course, have improved treatment in the hospital that we didn't have in March and April, with improved methods of oxygenation, which is really quite important, improved treatment of acute respiratory distress, that's that individuals on the ventilator, and we know now will respond quite well to steroids. And then research that is ongoing on what we call the acute cytokine storm. That is when often in that later stage when people are on ventilators, the seriously ill may need steroids and other items, and that's being researched. And the work that's being done on clotting research by the NIH. We also have new therapeutics that have been used both as compassionate use, like convalescent plasma, and now remdesivir, that we just reallocated and ensured it was available to these states that are facing the increased hospitalization, as well as the monthly allocations that we have been sending out. If we can go to the first slide, please, and start where the Vice President left off. Really, this disease is tackled community by community, testing at the community level and working with community groups to understand the spread in those communities. And so we've spent the time to really map this epidemic and new positives down to the level of communities to understand where spread is occurring so that we can match our prevention interventions to those areas. Next slide, please. As we discussed, and it's difficult for you to see on this graphic because the top line is New York. And we should remember where we were and that slope, that early slope that you can see in the case of the New York cases, that rapid acceleration. On the same slide, you can see California. That is the blue line that is just passing the orange line. And also on the slide is Texas in green, Florida in orange, and Arizona at the bottom. As dramatic as these slopes are, they are not equivalent to the original acceleration that we saw in New York. That doesn't mean that we aren't absolutely focused on working with the governors in those communities to stop the spread of the virus in those 4 states. Next slide, please. This shows you through the entire country that we're tracking state by state. Now, obviously, this axis is vastly different than the one on the prior slide because that slide included all of the cases in New York City. But you can see on this slide that we've been tracking very closely North Carolina. A team's been in with North Carolina working with the state and local public health authorities to really respond to the changes there, as well as the South Carolina at the bottom. Next slide, I'll just go quickly through these so you can see Oklahoma's at the bottom of this slide. And next slide, you can see on this slide Idaho and Oregon. Those are the ones in the light blue and the dark green where you see an inflection in their slopes. These inflection points and understanding when they occur and why they occur are critical for understanding how to prevent the spread. Next slide. Now, what the Vice President talked about is we've created an alert system that brings together what we just talked about, rising cases with an understanding of test positivity. And so this chart, which is difficult for you to see, those states on that far side that have the highest test positive that you can see at the higher level of the graph, those are the states that we have concerns about because of the rising number of cases and the rising test positive. This explains the extent of community spread. In states that have increasing cases but falling test positives, it tells us that they're getting into the communities to find the asymptomatic cases. And so these are the things we put together to understand the full picture. Next slide, please. So this really puts on one slide the states that we have, that we've been talking about across the South, where we have our greatest concerns. The two top states with the largest increase in test positives are Texas and Arizona, followed by Florida, Mississippi, South Carolina, Alabama, Georgia, Louisiana, Nevada, and Utah. Those last few states are under still 10%, but we're tracking them closely as we look at that individually. Finally, next slide. You can see on this slide, we are tracking, and this is when you hear about we have a certain 2% or 3% of the counties under specific alerts. So it doesn't matter the size of the county, we're tracking the increase and the rate of increase of new cases at the county level. We currently have about 130 counties out of the 3,100 in the United States in that category. Next slide. Metro level, this shows you the case positivity by the metros and the number of tests that have been done. Next slide. And then this shows you specifically the change over time of test positivity in the largest metros where we have concerns, and this is Austin, Phoenix, Houston, Dallas, San Antonio, Tampa, Orlando, Miami, Riverside, California, and Atlanta at the bottom. And so this is how we continue to integrate data on cases, data on testing, and data on hospitalizations so that we can work with the states for a comprehensive integrated response. Next slide. I know many of you would be interested in seeing how high the test positivity rate became in April and March and April. So that top line is New York City Metro, and you can see it reached over 50% on a series of days for almost 2 weeks. 50% of the tests were positive for COVID-19. Underneath that, you see New Jersey and Minnesota and a whole series of individuals. Detroit is the second large mountain. Next slide. So quickly to show you how we look at this at the state level and work with the governors and the local health authorities. So this is Florida. We track testing. It's done, the number of test positives that are in the blue line, the total number of cases seen in the black bar, and what we call the syndromic presentations of early respiratory diseases and pneumonias. Next slide. This then, we look at the county level to look for changes in the slope of the number of new cases. So you can see that top county that has the largest increase in slope in cases is Miami, Miami-Dade, followed by Broward and Palm Beach. All the other counties are much lower in their daily case increases. This allows us to focus resources and testing along with the state into these specific sites. Next slide. That all comes together to create this graphic so that individuals can understand and we can understand precisely what the rate of growth is and where the rate of growth is occurring by the shading of the boxes. Now I'm going to quickly take you through Texas because it's the same story. Next slide. So this shows you the exact same graphics now shown for Texas, showing a continued rise in the daily tests performed, but also a rise in the test positivity, the blue line. You can see throughout May, after opening, their test positivity continued to decline as their testing increased. It was in the last 2.5 weeks that we saw this inflection of rising test positivity along with rising testing. But it was the increase in test positivity that alerted us, along with the increased cases, that this was becoming an alert. You can see in the red boxes, everything is heat mapped. So at a glance, you can tell those two boxes that are in the middle that are red, that's the heat map showing that this has rising cases and rising test positivity. Next slide. But even in Texas, next slide please. And this gives you a map of Texas that shows where the cases are and where they're rising the most rapidly. And finally, I'm just going to go through Arizona very quickly along with California. So next slide. Same situation that we're showing here with Arizona, rising number of tests being performed, but also rising test positivity, rising cases. Next slide. Arizona is unique, and they have essentially one county that is primarily represented by the depth of the new cases, and this is in the Phoenix area. Next slide. Then next slide. So this is California. And so you can see California over the last week has had that increase in test positivity. You can see that dramatic increase at the end of that bar in the blue line, along with still increasing testing that has been done. And we just want to thank all of the governors and all of the work at all the laboratories that has allowed us, along with HHS and Brett Gerard, who ensured that the supplies were there to really increase these orange lines. You could see in each of these cases, these orange lines have dramatically gone up over the last 4 weeks. Next slide. And like New Mexico, the primary infections right now in California at the highest level are in the LA area. But because LA is a large metropolitan area, next slide, you really need this kind of more specific and local graphic to really show that it's also increasing in the Central Valley. And this gives us the ability to focus resources among agricultural workers to improve testing and isolation for those who become positive. So I just wanted to take you through how we've been looking at data, how we consolidate that data, and then Monday report it out to the governors. We hope over the next week to be able to really have this data available in real time on the White House website so that everybody across the country can see where the cases are. Because in the end, we really want to call to action. When we started talking about what can be done, we said the most important thing that would change the spread, and I'm going to turn that over because I know Tony's going to talk about it, is really individual behavior and our respect for one another through social distancing, wearing a mask, and ensuring that we're protecting the most vulnerable that may be in multi-generational households. And I just want to end by thanking again the millennials who have come forward. And I know during the protests we asked a lot of them to go forward to get testing, and we see those testing rates really improving in the under 40 age group. That is going to be important to continue to accelerate testing among the under 40 age group, because that's the age group most likely to have asymptomatic spread and be spreading the virus unbeknownst to them. And I want to really make it clear, no one is intentionally spreading the virus, but they don't know that they're positive, they don't have symptoms, and need to be tested in order to have that awareness. And so we really want to thank them again for coming forward and really enriching the amount of testing that has been done in the under 40-year-old age group. And to our older population, you know if you have comorbidities, you know if you're over 80. We ask you if in these hot spots in these states that are having expansion in cases to continue to shelter as much as you can and use your grandchildren to go and do your shopping.
Thank you very much, Dr. Birx, and thank you, Mr. Vice President. So I want to extend just for a couple of minutes some of the comments that were made both by the Vice President and by Dr. Birx, and it has to do with the situation that we find ourselves facing right now. It's very clear from the maps that you saw that there are certain areas in the country, states, towns, cities, regions, that are doing very well, that have followed the guidelines and are opening up in a prudent way that's been effective. However, as you can see, we are facing a serious problem in certain areas. Now, when you look at the map, it's very interesting because you see some dark parts of the map and some light parts of the map. We have a very heterogeneous country, but heterogeneity does not mean that we are not intimately interconnected with each other. So what goes on in one area of the country ultimately could have an effect on the other areas of the country. So let's take a look at this problem that we're facing now, this resurgence of cases. I don't think there's time enough now all day to try and analyze and figure out the multifaceted elements that went into that. You know, everything from maybe opening a little bit too early on some to opening at the right time, but not actually following the steps in an orderly fashion, to actually trying to follow the steps in an orderly fashion, but the citizenry did not feel that they wanted to do that for a number of reasons, likely because everyone feels the common feeling of being pent up for such a long period of time. So we're not going to say blame, we're not going to try and analyze it, but there is something that's very important about it that I'd like to get a message to the country in general. When you have an outbreak of an infectious disease, it's a dynamic process that is global. So remember, what happened in China affected us. What happened in Europe affected us. What's happening here is affecting others. We can't get away from that. It's interconnected. So therefore, if we are an interconnected society, we've got to look at the fact of what our role is in trying to put an end to this. Because everybody wants to end it, everybody wants to get back to normal, and everybody wants the economy to recover. I think we all are pretty common in that. That's a given. So what can we do? What I think, upon talking to a lot of people and reflecting on it, we have such an unusual situation because of all of the decades that I've been involved in chasing infectious diseases. I've never seen anything that is so protean in its ability to make people sick or not. There's no other infectious disease that goes from 40% of the people having no symptoms to some having mild symptoms, to some having severe, some requiring staying at home for weeks, some going to the hospital, some getting intensive care, some getting intubated, some getting ventilated, and some dying. So that depending on where you are in that spectrum, you have a different attitude to this particular thing. But anyone who gets infected or is at risk of getting infected, to a greater or less degree, is part of the dynamic process of the outbreak. And I know, because I can understand when I was at a stage in my life when I said, well, I'm invulnerable, so I'm going to take a risk. I think what we're missing in this is something that we've never faced before, is that a risk for you is not just isolated to you. Because if you get infected, you are part, innocently or inadvertently, of propagating the dynamic process of a pandemic. Because the chances are that if you get infected, that you're going to infect someone else. And although you may feel well, and because we know, if you look at the numbers that you'll probably hear later on, the overwhelming majority now of people getting infected are young people, likely the people that you see in the clips and in the paper who are out in crowds enjoying themselves, understandably. No blame there, understandably. But the thing that you really need to realize, that when you do that, you are part of a process. So if you get infected, you will infect someone else who clearly will infect someone else. We know that happens because the reproduction element of the virus is not less than one. So people are infecting other people. And then ultimately you will infect someone who's vulnerable. Now that may be somebody's grandmother, grandfather, uncle who's on chemotherapy, aunt who's on radiation or chemotherapy, or a child who has leukemia. So there is what I call, and again, I just want to bring this out without making it seem that anybody's at fault. You have an individual responsibility to yourself, but you have a societal responsibility. Because if we want to end this outbreak, really end it, and then hopefully when a vaccine comes and puts the nail in the coffin, we've got to realize that we are part of the process. So when the Vice President went back, pulling back a couple of months ago, when we showed about the guidelines to safely reopen the country, we've got to make sure we drop back a few yards and think about that this is part of a process that we can be either part of the solution or part of the problem. So I just want to make a plea with people when they understand the stress that they're under, as we try to tackle not only those states, but the light-colored part of the country. Even though they've done well, they may have gotten hit badly like New York and then came down, or they may not have got hit badly at all. They are vulnerable. If we don't extinguish the outbreak, sooner or later, even ones that are doing well are going to be vulnerable to the spread. So we need to take that into account, because we are all in it together, and the only way we're going to end it is by ending it together. Thank you.
Well, first, thank you all for joining us here at HHS to update the American people. I want to begin by thanking everyone around the country working to defeat this virus. all of the healthcare providers on the front lines, those working to reopen our economy safely, the American people who have sacrificed so much in this fight, and the incredible members of our HHS team who've been working tirelessly to protect the health and well-being of all Americans. Before covering today's topic, I want to mention a major milestone for global health yesterday: the end of the second largest Ebola outbreak in history in the Eastern Democratic Republic of the Congo. We congratulate the Congolese government and all of the healthcare workers and community members involved, some of whom I had the chance to meet and thank in the DRC last fall. Under President Trump, the United States was proud to play a bigger role in this major public health victory than any other single nation. And now, thanks to the President and the Vice President's leadership and the hard work of our team, America has never been readier to combat COVID-19. We've built up our readiness under the strategy we developed to address surges, save lives, and in time defeat the virus. We're in a much stronger position to support states, hospitals, and individuals as they fight back. There are 6 parts to the strategy: surveillance, testing, containment, healthcare capacity, therapeutics, and vaccines. First, we've been strengthening surveillance so that we can be aware of and respond to surges. That means, for instance, being able to track more cases among younger Americans that we never would have caught earlier in the pandemic. Second, we have the world's greatest testing capabilities, enabling us to confirm the presence of the virus when it crops up, and we're confident that capacity will continue to rise in the coming months. Third, states are building the capacity to track and contain outbreaks of the virus. With federal help, many states have substantially expanded their own capabilities, and we're deploying knowledgeable, experienced CDC and HHS public health teams to the areas now seeing increases, with a focus on community testing and community-based interventions. Fourth, we're helping healthcare systems secure sufficient capacity and supplies. We've dramatically expanded American manufacturing of PPE, and the FDA has authorized new technologies to sterilize equipment for reuse. We've spoken with hospitals and states that are building up their own PPE reserves, many of them getting up to 60 or 90 days of supplies. Through the Strategic National Stockpile, we have far more visibility into the supply needs across the country, including centralized coordination capabilities that we lacked just a few short months ago. Visiting healthcare providers around the country, I've seen how they're adapting to bring patients back while taking appropriate precautions. America's hospitals are ready to get back to business while maintaining their readiness for COVID-19. The fifth and sixth elements of this strategy are thanks to the President's Operation Warp Speed. We now have promising therapeutics that are benefiting tens of thousands of American patients and in all likelihood have already saved thousands of lives. We've identified 2 very promising pharmaceutical treatments, remdesivir and dexamethasone. As of today, we've allocated more than 120,000 courses of remdesivir to all of the 50 states. We've added dexamethasone, a very low-cost steroid, to our treatment guidelines, and we believe it's reasonable to assume that other corticosteroids, which may be more readily accessible in some places, would have similar immunological effects. Another promising therapeutic, convalescent plasma, has been used to treat more than 25,000 Americans in nearly 3,000 sites across the country. There are no certainties in science, but with more than 140 clinical trials underway in the U.S., it's a pretty safe bet that more good news on therapeutics is on the way and on the way soon. Finally, we've announced large investments to support 3 different vaccine candidates all the way through to manufacturing. These candidates are now in human clinical trials, some with the potential to start delivering safe and effective doses before the end of the year, and we'll be adding support for several more candidates. We're expanding manufacturing capacity and already making the vials, needles, and syringes that we may need. Our capabilities have grown exponentially in the time allowed by the patriotic sacrifices of the American people. We have a much better grasp of the virus, as Dr. Birx said, and much more data with which to model it. With that data, as you've heard today, we can focus on local trends. We have some very concerning hotspots, and we can track when other hotspots emerge, as we expect they may. We're focused on the states and the counties within those states, just 3% of counties that represent hotspots. It's important for the American people to be aware of this variability and variation across the country. Americans need to understand their local trends because we want to help people make the right decisions for themselves. Making decisions for yourself has to be based on 3 axes of risk, as our Surgeon General taught us in March. You want to assess where you are, who you are and whom you live with, and what activity you're thinking about doing. There are gradations of risk within each of these axes. Going to an outdoor restaurant in Montana is a great deal different from a crowded indoor bar in Houston. When you interact with fewer people in an activity, when you interact with them for a shorter period of time, your risk is reduced. And individuals can balance these kinds of factors. What I've laid out today is remarkable progress by the President's administration, and a particular credit to the team here at HHS. We've got a lot of work ahead of us, but Americans can be confident that we have a rock-solid foundation to help us get safely back to work, back to school, back to worship, and back to health care while we tackle surges of the virus where they occur. Thanks to President Trump's leadership, we've got the capabilities, the knowledge, and the strategy to protect Americans' lives and their livelihoods at the same time. And every American should feel proud of that. Thank you.
Great. Great.
Thank you, Mr. Vice President. I wanted to add some comments. Once again, I want to stress and thank all Americans to embrace the importance of social distancing recommendations to slow the spread of COVID. As I've said before, we're not defenseless. These are, in fact, very powerful weapons, and it's our collective responsibility to recommit ourselves to put them into routine practice. Again, to stay 6 feet apart from each other as much as possible, to wear face coverings when we're in public, and to practice vigorous hand hygiene. And to commit to do so, as we've heard today, to do our part to protect the vulnerable. I also want to appeal to the millennials and those that are under 40. It's really important that this group really commit themselves to these practices to protect those at risk. And it's not just the elderly that are at risk. Many of us may have friends and colleagues that are younger that may not advertise their underlying comorbidities, as the case would be with, say, type 1 diabetes or an underlying immune deficiency. So again, asking this team of millennials and younger people in this country to come and commit themselves. I agree with Ambassador Birx. We're very thankful that the group is now coming forward to get tested, but I also want this group to put into vigilant practice the importance of our social distancing. The one thing that I wanted to stress, though, is that there are differences in what we're experiencing today than what we all experienced in March and April and May. And one of the things I want us to focus on is not the cases per se, but the consequences, the impact of those cases. It wasn't long ago, probably within 2 months ago, it's hard to believe, I don't think many people realize, that 27% of all deaths that occurred in the United States actually died of a pneumonia. That was a pneumonia, could have been influenza, could have been COVID. 27%, 1 in 4 of all the deaths in the United States just 2 months ago was caused by pneumonia. I'm happy to say today the deaths to pneumonia in this nation is back to baseline. It's about 7%. It's a big difference. A lot of those pneumonias that were dying were actually COVID-infected individuals that were the elderly, the nursing homes, and individuals with comorbidities. We are seeing, despite these increased cases, we have seen a progressive decline in deaths. The last, say, 2-week average deaths in the United States now is around 650, and as you heard the Vice President, it wasn't long ago that sadly we were losing 25,000 individuals a day. So I think it's critical that we continue to focus on that, the consequences. And it's part of that why it's important that we continue also to look forward to how we deal with and contain and control the COVID infection but as we also change the consequences of the impact it's had on education in this country, or as an economy and business. So again, as I close, I want to just re-emphasize how important for now, for individuals to really think seriously, as Tony said, about the responsibility to others that we have, because this infection pathogen really does have the capacity to cause quite serious illness in individuals at high risk, and embrace our nation's recommendations that the Vice President put up again, that we have for all phases of reopening America. Again, I also want to thank the younger groups for stepping forward and getting tested. Clearly what we're seeing now is this age group is much more likely to be asymptomatic, and again, to make that commitment to do their part to protect those of us that, whether we're young or old, have a comorbidity and would be more vulnerable to serious illness from this virus. Thank you very much.
Thank you, Dr. Redfield. Questions?
Mr. Vice President.
Yes, please.
All of the experts here within the task force are stressing the importance of social distancing and also the threat of crowds, yet your campaign has held 2 massive rallies, no social distancing, no masks. Can you tell me, even Dr. Fauci has talked about not gathering in large crowds. Can you tell me why you continue to do this, why the campaign continues to hold these rallies?
Well, the freedom of speech, the right to peaceably assemble is enshrined in the Constitution of the United States. And we have an election coming up this fall. And President Trump and I believe that taking proper steps, as we created screening at recent events and giving people the very best counsel that we have, we still want to give people the freedom to participate in the political process, and we respect that. I was pleased to see that now the better part of a week since we were in Oklahoma, I think their positivity rate is actually declined as of today, and that's a great testament to the fact that people are using common sense. They're being responsible. They know and understand what's happening in the community in which they live. And our emphasis today is really to say that we think it's most helpful if the American people understand that what we're seeing across the South today is really outbreaks. And there are outbreaks that are in specific counties. In some cases, there are outbreaks that are in specific communities. We've surged CDC personnel, HHS personnel. I didn't mention before, but 3 weeks ago when we were seeing similar activity in North Carolina and Alabama, we sent personnel into those states, and we've actually seen declining numbers beginning in both of those states. So the important thing is that not one size fits all. The overall guidance to every American to practice good hygiene, to practice the measures that we recommended at home and at work stand. But our focus today is to make sure that in those areas of the country where we're seeing a significant, not only increase in cases, but an increase in positivity level, that the American people know just how important it is to listen to what their state and local health officials are directing them to do. Please.
I was curious, it seems like the wearing of masks has kind of become a political statement, or I guess the decision not to wear a mask. Are you concerned about that? And is there a message that you would like to send to people about the importance of wearing masks?
Well, we think that the first principle is that people ought to listen to their state and local authorities. I mean, I have to tell you, President Trump and I couldn't be more grateful for the partnership we've forged with governors around the country. I spoke to the governor of Florida, of Arizona, of Texas, just within the last 12 hours. And I told them that from this podium today, we would remind their citizens to heed the guidance and the direction of state and local officials. In some cases, there's statewide guidance with regard to facial coverings and with regard to events and gatherings. In other cases, there are specific countywide or citywide directives. And we just believe that what's most important here is that people listen to the leadership in their state and the leadership in their local community and adhere to that guidance, whether that have to do with facial coverings, whether it have to do with the size of gatherings. And we'll continue to reinforce that message. Please.
What is the correlation between the spike in cases that we're seeing in states like Texas and Florida and the way those states handled their reopening? Was it too much too soon? And secondly, I wanted to ask Dr. Fauci, you said in an interview that, quote, something is not working. What isn't working? And did you all in your meeting today come up with a plan to fix whatever isn't working?
Well, let me respond first, and then I'll let Dr. Fauci address it as well, and Dr. Birx may as well. I think there will be a temptation for people to look at these Sun Belt states that have been reopening and putting people back to work, and suggest that the reopening has to do with what we're seeing in the last week or so. But frankly, in the case of each of these states, they reopened, in some cases, almost 2 months ago. And their test cases, their new cases that from testing was low and steady. Their positivity rate was low. What we're observing today, and I've heard this from Florida, I've heard this from Texas, and some other states along the Sun Belt, is that we're seeing more and more young people under the age of 35 who are testing positive. In many cases, they have no symptoms, but they're coming forward and confirming that they have contracted the coronavirus. We're working with the states. You speak about our plan. We've got CDC personnel embedded in every state in the union. We're surging more CDC personnel as requested to each of these states to help them unpack what the data is suggesting. I know the governor of Texas announced some new measures this morning, which we fully support. But what we're going to continue to do is give our state leadership the very best information, the very best counsel that we have. And if there's one message that comes through today, I hope it is saying to younger Americans in these states and in these counties in particular that they are a big part of the numbers that we are seeing in new cases. And while there may not be a significant threat of a serious health outcome to them, I know of no young person, and I got 3 20-somethings in my immediate family. No young person would ever want to inadvertently expose a mom, a dad, a grandmother, a grandfather, or someone who's vulnerable to a serious result. And so alerting them that there's been spread among that age group, urging them to take countermeasures and heed what their governors and local officials are directing will be our continued strategy. Dr. Fauci, did you want to respond?
So what I meant by what is not working, and this is not anybody's fault or any institution's fault, is that what we're dealing with right now is community spread in the context of a substantial proportion of the people who are getting infected do not know they're infected, they're not symptomatic, they're asymptomatic individuals. The classic paradigm of identification, isolation, and contact tracing to actually contain that is very difficult to make that work under those circumstances. You superimpose upon that the fact that even with identification, isolation, and contact tracing, often the dots are not connected. If you get on the phone and talk to people who are in some of these communities, you find that a lot of it is done by phone. And when it's done by phone, maybe half of the people don't even want to talk to one who they think is a government representative. If you live in a community that is mostly brown or black, you're in a different situation that maybe 70% of them don't really want to talk to you. You can identify a contact, but you don't isolate them because you don't have the facility to isolate them. That is what's not working. So what we're going to do, and we are doing, and you're going to be hearing about this, flooding the area of a community to get a feel for what's out there, particularly among the asymptomatics. So in other words, it's a paradigm shift because we're dealing with young people, people who are going to be asymptomatic, and people who are getting infected in a community setting, not an outbreak setting where you know who to identify, isolate, and contact trace. That's what I meant.
So Dr.
Yeah, did you want to add to that?
Dr. Fauci and Dr. Birx.
Can I just want to finish it, expand his thought for just a second. About 3 months ago, we talked about how important it was to have community at the center. And I think when you talk about what's going to be different, and part of the reason why the President and Vice President have asked me to go out to Texas, New Mexico, and Arizona, is to not only meet with the state and local health officials, but to meet with the community groups, so that the community groups can help us support community-specific messaging. Public health messaging, when you just keep saying the same thing over and over again and the people get tone deaf to it, it's because it's not tailored to their specific circumstances and they don't see that message resonating in their lives. We've had to do this across the world. I've done this over and over again for HIV, TB, and malaria. At the center of this has to be the community, and the community will help us identify who needs to be tested. They'll help us identify which households have the most vulnerability in them, and how we can really go into those communities and support that response at a very local and ground level. When we started this, we were very much facility-based, and we know facilities carry us a long way. But if we want to change the transmission rates in these metros, in specific communities and in specific parts of those metros, we've got to walk side by side with our community leaders and our community groups that know how to translate our scientific dogma and information down to a level where people will understand it, hear it, and act on it. I know when they hear it and understand it, they will act on it. And so that's how, when you ask what's going to be different, that has already started, and it's already going to be different.
Dr. Birx.
You know, just let me add to that. That's exactly what we did with HIV 30 years ago. We got the community involved in helping us to outreach. And I think that's very important to underscore what Dr. Birx said. And that's exactly what's being planned to do, to get people who know the community, who live in the community, who the community trusts.
Right, right, let's go. How about right here?
Do you expect the death rate to go up in the next 3 or 4 weeks, just like we're seeing the rate of infection go up now?
Well, our hope and our prayer is that it's not the case. We've seen, as you noted, we've seen a precipitous decline in fatalities. And again, one is too many. We grieve the loss of every American life. But the fact that 2 months ago we had lost 2,500 Americans in a single day, in 2 days this week we lost less than 300 Americans, it is a testament to our healthcare workers, to all of the medicines that Secretary Azar just described being available in all 50 states. It's a testament to the efforts of the American people, and we hope as we continue to engage that we'll continue to see those numbers decline. The other reason we're encouraged is because at this point, when we look at our losses, roughly 2.5% of all of our losses took place in people under the age of 25. I mean, younger Americans, and in each case, or at least 90% of the cases, they were people with pre-existing conditions, underlying conditions that contributed to the sad outcome. So as we see that in Florida and in Texas, they've reported to us that half or even more than half of the new cases that are showing up every day are people under the age of 35 or younger Americans, in most cases asymptomatic. Our hope is that those younger, healthy Americans, like most have already, will continue to go through the coronavirus, will recover. But our message today, as we've spent so much energy in the last 4 months protecting the most vulnerable, I mean, we've deployed testing resources, we've supported states' efforts. States across the country in the last month have answered our call to test all the residents of their nursing homes, to set up a plan to test all of the staff on a regular basis. We need to protect the most vulnerable, and we want a message going out to younger Americans, particularly those along the Sun Belt, in these counties where we see new cases on the rise, positivity on the rise, to know that we need them to do their part to make sure and protect the most vulnerable, so that we don't see those losses rise. But it's in the hands of the American people, and particularly young people in this country.
All right, guys, last question.
Right there.
Thank you. A question for you, and then a question for the doctors on childcare.
Sure.
On the campaign, it really does sound, though, like you're saying, do as we say, not as we do. You're telling people to listen to local officials, but in Tulsa, you defied local health officials to have an event that, even though you say it didn't result in a spike, dozens of Secret Service agents, dozens of campaign staffers are now quarantined after positive tests. And then in Arizona, one of the hardest hit states, you packed a church with young people who weren't wearing masks. So how can you say that the campaign is not part of the problem that Dr. Fauci laid out?
Well, I want to remind you again that the freedom of speech and the right to peaceably assemble is enshrined in the Constitution of the United States. And even in a health crisis, the American people don't forfeit our constitutional rights. And working with state officials, as we did in Oklahoma and as we did in Arizona, we're creating settings where people can choose to participate in the political process, and we'll continue to do that. I think it's really important that we recognize how important freedom and personal responsibility are to this entire equation, but allowing younger Americans to understand, particularly in the counties that are most impacted, the unique challenges that we're facing in their age group, we think is important. But look, it's so important that we recognize that as we issued guidance to reopen America now 2 months ago, and now as all 50 states are opening up our country again, people are going back to work, American everyday life is being restored kind of one step, one day at a time. I think it's important that we remind ourselves this is not a choice between the health of the American people and a strong economy. There are profound health implications to the lockdowns through which we just passed. I heard a statistic not long ago at a task force briefing that in one jurisdiction there had been a 50% increase in the number of people presenting at emergency rooms having attempted suicide. I mean, there are profound mental health issues. There are profound economic issues, people needing to be back to work. And so our objective here today is just to make sure the American people know in 34 states, the cases are largely stable, and there's no combination of rising cases and rising positivity rates. That's a tribute to the American people. And in the 16 states we're focused on today, we simply want to equip particularly young people with the knowledge of the part that they can play in stemming the rising tide of new cases. Not because the coronavirus represents a significant threat to them. In most cases it doesn't if you're a younger American. But because no younger American would ever want to spread the coronavirus to someone who would have a serious outcome. But I'm grateful for the time today. We hope this has been helpful. And we'll be back with more information as time goes on. Thank you.
All right, there you have it. For the first time in almost 2 months, an update from the Vice President and the Coronavirus Task Force. Today, we heard Houston and Texas mentioned a lot. Clearly, we are one of the hot spots in the country right now. We were at the top or near the top of a lot of the graphs that we saw from Dr. Birx here just a little while ago. The overriding message from the Vice President here during this press conference was asking everybody across the country to listen and respect the guidance of your state and local authorities. And we have heard from both the Harris County Judge and Governor Abbott today, tightening restrictions, new advisories as we surge here in the Houston area. We're expecting to hear from Houston's Mayor, Sylvester Turner, coming up here in about 2 hours at 3 o'clock. We'll be carrying that here live on KHOU on the TV side, also on our digital platforms as well. So we hope you will join us then. We're going to send you back for now to regular programming. Again, stay up to date all the time. You can do that on our website, khou.com, and the KHOU mobile app. I'm Russ Lewis in the newsroom. We will